Are you unsure how to be patient-centered? Maybe you're asking questions or you're saying things that might appear to be formulaic. This is a common problem that GP trainees face. Yesterday I was on a coaching call and a GP trainee told me, when I say something, it sounds like it's not genuine, so I'm not sure how to deal with that. In this video, I'm going to show you practical tips that you can implement in your consultation to be more patient-centered. The first one is to actively listen to your patient. This is a problem when you're feeling stressed and you're stiff and you're not really listening to your patient. You're asking questions, but in your mind, you're thinking, what question should I ask next? And when this happens, you're not present in the consultation. So it's very important to really listen to your patient and be present in the consultation. When you're present in the consultation, giving your patient your full attention, that way, you're going to show interest and you're going to ask a follow-up question. You're going to respond to cues. Whereas if you're in your head, then you're going to miss these cues and you might ask repetitive questions. And the patient might be thinking, oh, this doctor is not really listening to me. So first thing is listening. Pay attention to the patient. And don't just listen with your ears, but listen with your eyes. See how the patient is responding. Listen and pay attention to what they're not saying as well. Pay attention to the tone of voice, to if there's any hesitation, if there's any sigh. These things really matter. When you're picking up on these nonverbals, then you're going to be able to ask the right questions, and that's going to help you to lead the consultation. Tip number 2, avoid saying things that sound formulaic. A lot of people want to have a script what to say, but it's how you say it that matters most. If you're not saying it the right way, then it might sound dismissive or it might sound unnatural. So it's important that you pay attention to how you say something. It's not just about what you're saying, but the tone of voice and the intention and whether you're actually looking at the lens when you're speaking or you're looking up and you're saying something. All this matter in the interpersonal skill. So let me give you an example. This morning I was coaching a GP trainee. One of the bad habits that he has is saying things like, okay, yes. Inadvertently, he appears to be slightly dismissive when he says something like, yes, okay. And this is a problem I also had in training. My supervisor actually highlighted this, and that's how I realized it. Sometimes you don't know what you don't know. You don't know your blind spot. And it's really important that somebody else points out that what you're doing here might sound slightly dismissive. And that's when I corrected it. You might not be aware what you're doing and the bad habits that you've been picking up for many years. It's very important to get a fresh pair of eyes to look at what's going on in your consultation, and then you can correct the bad behavior and learn new behavior. So these small things make a big difference in the whole of the consultation. Are you feeling unsure about the SCA? Maybe you don't know what to do or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA Blueprint, click the link down in the description below to get access to the SCA Blueprint that GP trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it. Tip number 3 is to bring a positive energy in the consultation. If you're introverted like me, you might have a very low energy. And when you consult, so for example, if I start a consultation, I say, hi, this is Dr. Kwun calling from the surgery. How are you doing? It doesn't bring that positive energy, no enthusiasm. And the patient might feel like, I don't want to be here. Whereas if you bring the energy level higher, you have a better presence in the consultation with higher volume. Then let me show you the contrast. Hi, this is Dr. Kwun calling from the surgery. How are you doing? So you see, the patient will feel this doctor is interested in me, seems to be friendly and is greeting me, seems to be confident. So all of these matter. So make sure that you work on your first impression. The energy you bring in the consultation makes a big difference in how the patient is going to react to the energy you bring in. If you bring a low energy, you might bring this energy that's going to lead to the patient not really wanting to answer your question. When you bring the energy level high, what you might find is that towards the end of the consultation, your energy level drops back to the usual. So make sure that you maintain that high energy level in your consultation. For the exam, when you're having to consult 12 cases, it might be quite tiring. So that's where it's important that you arrange a mock closer to the exam and see how you do it. Last but not least is to adapt your explanation based on the patient you've got in front of you. So often I've seen trainees over-explaining, overloading the patient with too much information. Just this afternoon I was coaching a GP trainee, and one of the things that we discussed was the fact that he was saying, I'd like to do some blood tests to check your thyroid level, to check the vitamin B12, the folic acid. Also like to make sure that you don't have any problem with your head, so I'd like to arrange a CT head scan. By saying so many things to a patient, then you might create uncertainty and anxiety in your patient. So yes, you have to verbalize your differential and the most likely differential so that the examiner understands what is it that you're thinking, but you don't have to overload the patient with too much information. The explanation needs to be adapted to your patient. Don't try to impress the examiner, but explain so that your patient can understand. It's a patient first, and as a result, the examiner will pick up on what you're doing and will score you well for the explanation. But if you try and explain and use jargons, you're going to lose your patient. If you found this video useful, you might want to watch the next video here. Click here to watch it. I'll see you on the other side.